Hi everybody, it's Andrea. I want to take a quick second to show you the updated processes for using the Sandata mobile app to log in to your patients with CenCal MediCal. And I'm doing this manually, so I'm sorry if the screen shakes. When you have a purple sticky attached to your chart that says EVV mobile app Sandata required, it's been explained that this is a requirement to prevent any misinformation about potential Medicaid fraud. And so it's a requirement that we have to utilize a clock in and clock out process at that patient's home. And the Sandata mobile app, if used correctly, is going to geotag us at that location. So it gives me my login number that I need to use to clock in and clock out from the patient's location. So when I go to do this, and you're gonna forgive me, I'm gonna be two-handed here. I am going to, on my iPad, or I have it on my phone, I am going to open up my Sandata mobile app. And I use my Face ID, and give me a second, I'm just gonna make it do my face. But what I wanna show you is that when I use my Face ID to log in, it doesn't log me in. All it does is put the password in there for me. Then I have to click sign in, and it looks like I've got nothing. It looks like I've got a blank screen. So, sorry, I have to do it this way. So now what I do is I come up and I tap these three bars and I search for clients. Don't use any other features in this. Don't go to past, don't go to other things. And then you're gonna type in, and so as you can see, I have an authentication number that tells me this is this person's number that you're gonna use when you sign into the Sandata app. This starts at the beginning of my visit, and so I enter that client's number. I'm sorry, it's kind of 169124. And I say search. And when I do, it gives me the name of my patient. Don't use any of the other items on here. Just say start visit. And when you do, it's asking you to identify what your clinical role is. Are you a PT, OT, speech, medical social worker, RN, or LVN? And Medicare, Centers for Medicare Services says on home health that our visits have to be at 30-minute increments. And I understand that this says 15 minutes, just you need to keep standards with what Medicare requires of us. And so you choose your discipline and you say continue, but wait, there's more. This community versus home. So this is about identifying where we're providing care for the patient. And if it is where the patient lives and gets their mail and such like that, then that would be their home. But maybe they live at this place, but they are at an adult daycare center today, and I am meeting them there, then I would choose community. If perhaps they're staying with their daughter while they're recovering, I would choose community. If they're in a very temporary situation in a residential care facility and they're going to be going back home, so their wife lives at home, but they're staying in an RCFE, then I would choose community because that is not their current home. But if wherever I am, if they are permanently in that RCFE or if they are permanently in an assisted living and that type of thing, then that would still be considered their home. And so whichever you choose, you tap continue, and then it says, are you sure you want to start the visit? And you say, yes. Now, right now I have a visit in progress. And if I go up and knock on the door and there is no one there, then I am going to tap. Really, I am. Oh my gosh. I'm going to tap on the trash can and say abandon visit. And then I would say yes, and it would take me to the process of not having that visit having ever been started. So now what I want to do is show you. The problem with logging in doesn't seem to be the biggest hiccup, but I'll go over a couple of possibilities for you. But it's remembering to clock out. So you get to your patient, you open up WellSky, you go do your thing, you've logged into Sandata, and then 4 hours later, you accidentally realize, oh shoot, I forgot to clock out. And what I train all of our new hires to do is to keep a set of sticky notes in the car. And literally, I put one of these, just one, on my dashboard, you know, on the place where my speedometer and odometer are. I've tried it on my steering wheel and it falls off. But this is there so that when I get in the car, I'm like, oh shoot, I have to go clock out of that Sandata app. So I have to clock out, so I have to log back in. Give me a second, it's gonna log me in. And when I do, it's going to show that my visit is in progress. And so now I want to tap on that, and don't put visit notes or anything in, just say complete visit. And where did you complete the visit, home or community? Wherever you chose should be where you're continuing. And then it says confirm that you want to complete that visit, and then you're done. So when you first log in, it doesn't look like you have much. It looks like this, but when you tap on clients, you'll get a search bar. Well, I've messed with it, but that'll look like this, and you can enter that authentication number. Don't ever go down and start an unknown visit. And then the last thing to know is in the event that you have either gotten out to the location and there is no cell service, the app is not working, you forgot to clock in, you forgot to clock out, you're gonna send a Kmail message to electronic visit verify Kmail and give with the patient's name attached to the chart and give the information about what happened. Then Shauna can go in and manually correct that. We need to not use that as a default. We need to use that as an exception, but sometimes things happen. So always reach out to electronic visit verify if there's been a snag. If you have gone out and forgotten to log out of your patient, you should still be able to hopefully log into your next. Don't log out of that one in a new location. It'll geotag you at a space that doesn't match where the patient was. Let Shauna at Electronic Visit Verify do that log out. I hope that was helpful, and if you have any questions, let me know. Thank you.